Welcome to It Starts With Mom. Today we are talking about labor and what to know when you are expecting. Hello, I am Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and now I help millions of people online through social media, my podcast, and my websites. And today I'm connecting with Dr. Amanda Williams. She is the March of Dimes Interim Chief Medical Officer and an adjunct clinical associate professor of obstetrics and gynecology at Stanford Medicine. Her primary area of clinical interest is collaborative obstetrics and maternity care. Hello, Dr. Williams.
Hello. It's so nice to be here. Thank you so much, Hilary.
Yes, and we are talking about everybody's favorite topic who's pregnant, labor. How do you get that baby out of you, right?
And usually by the end, you're ready for the exit.
Yes, you're like, if it's like Alien, that's fine. Cool.
It's true.
Yeah. I think the worst thing about labor is that it is different on every baby, every person. It's super unpredictable. And people, especially if you've already had a baby, you're like, oh, number 2 will be just like number 1. Or if you're talk to your mom or your sister, you're like, well, I'll labor like them because we all have the same DNA in our pelvis. And that is not true at all.
Not in the least. And in fact, that is one of my favorite myths to dispel. Because oftentimes people say, well, my sister did it like this, and so that will be my experience. And I was like, no, because there's a passenger who has their own agenda. And of course, everybody's body and medical circumstances are all different.
Yes. But there are some patterns that like the vast majority of people go through. So today we want to spill the tea on those patterns so that people can know kind of what to watch for, because it's surprising. Also, you think it's just contractions like in the movies, but it's not.
It's true. I mean, it is wild. It is beautiful. It is natural. And sometimes it's hilarious. It can be all of the different things. There are not a lot of places in life where that degree of sweat and science come together to make this thing happen. And we've survived as a species because it does happen. So it, as you said, it's not necessarily the most intuitive thing. So it is worth getting some education on the topic.
Oh, definitely. Okay, so what are some of those things that most people see as they're heading into labor? What should people be watching for?
So the definition of labor is strong, regular uterine contractions that result in cervical change. However, unless you have the longest fingers in the world, you don't know if your cervix is changing. And what do each of those words mean? So when we say strong, what might be strong to one person might be like a cramp to another person. And so that's something that can be a little bit tricky for folks. And a strong pain, a strong contraction, sometimes it's in the front, sometimes it's in the back. And so that can also be very unique and sometimes a little confusing. Regular. What does regular mean? In these situations, when we say regular, what we mean is in a predictable pattern. So every 5 minutes, every 4 minutes. And there's that 4-1-1 rule. If it's every 4 minutes for a minute, for an hour, that's when you start thinking, is this really labor? And then the signs that the cervix might be changing. So a mucousy discharge, you might hear about losing the mucus plug. So that mucus that sits in the cervix. And okay, a lot of people ask, what does it look like? And I always say it looks like boogers is what it kind of looks like.
It looks like it was named right.
Yes, exactly. But like a watery discharge, a boogerish discharge. And often it'll have some blood in it. A little bit of blood is normal. A lot of blood is not. And so that's something maybe to be concerned about. And then the water. So there could be watery discharge or there could be the water breaking. So all of these things, this simple sentence, a strong regular contractions resulting in cervical change is actually more complicated than it seems.
I know it seems like such a simple sentence, but it is definitely not, especially when it is happening to your body, right? Hilary is a nurse. I could say that very easily, but when Hilary was the patient, just a mess.
Exactly.
Yeah.
Especially when you're a rookie.
Okay, so Dr. Williams, what is something memorable that you have seen in labor?
Well, I was giving this question some thought because I've been doing this for 20 years. So I've seen a heck of a lot of labors. But I think the one that got me the most was I was in the charting room and putting some notes on another patient. The nurse called me to say, I think, room number so and so is getting ready. And so I went and I knew she was pushing. Was watching her on the monitor. And I went back in there expecting that, I could see a little bit of head coming through and that she was getting ready to deliver. But what I was not expecting is that her mother and her husband, who were both there with her, would both be on the ground with their legs pulled up, getting into a pushing position and pushing with her. And I mean, I am all for empathy and for using your team for support, but I have never seen anything like that. So I acted really cool. I was like, oh, this is great. Everybody's pushing. But it was quite a sight. I don't think I've ever seen that again.
Yeah, wow, that's a lot.
Yes.
So for me, we once had a young patient come in, and she asked us if she could pick which hole the baby was going to come out of. I was like, how do you think we would pick? And also, would you pick a different?
I'm like, did she mean a C-section? Like an abdominal?
I don't know. Like, she didn't end up being my patient long term, but I was just like, you're admitting you have so many questions. I was like, okay. Or the mom was like, can you tell her you can't pick which hole? Anyway, it was just like, okay, but that's the one I would pick.
Well, I will tell you though, and as I'm sure you know, so many patients, you feel that rectal pressure so much.
That's true.
That it does sometimes feel like it's coming out the other hole down there.
They are close to each other. I thought my last baby was going to come out my hip, like just come shooting out of my hip socket. So I was like, I've never seen that before, but maybe that's a thing.
It sounds like a Greek myth or something like that. Like the kids come out of Zeus's forehead or something like that.
Yeah. Okay, so there's true labor, but then there's that sneaky false labor. So how can you tell the difference, Dr. Williams?
So, first of all, I hate the word false labor because it makes people feel like a failure or like they're making it up. And it's certainly not false. There is something happening. There is tightening of that muscle happening, but it doesn't necessarily mean that it's the tightening that's going to result in your baby coming out. And that can be on a spectrum. That can be what are called Braxton Hicks contractions or practice contractions. So that's why I usually call it practice labor instead of false labor, because your body's getting ready. Like if you are going to run a marathon, you're not just going to get up and run a marathon. You're going to practice ahead of time. And the uterus is one giant muscle. In fact, from a physiologic standpoint, it is a miracle that labor just doesn't happen all the time. And in fact, in the research, what we're seeing is that it's the progesterone and certain progesterone receptors blocking it that keeps labor from happening, because a muscle is built to contract. So the contraction is totally normal, totally natural. When it's the false or practice type, those Braxton Hicks contractions, typically they're shorter, so they're less than a minute. Typically they feel tight and crampy, but not actual take your breath away painful, and they don't organize. I mean, that doesn't mean they build a spreadsheet. It means they don't get into that predictable pattern of, every 4 minutes. They're kind of more random.
Yes. And it gets tricky. A lot of times I feel like you don't even know that it ended up being true labor because it was that practice labor for kind of a while. And a lot of times it's doing things to your cervix that maybe isn't pushing baby into the birth canal that we can tell, but it's softening things up. So people should never feel like their body's a loser.
Exactly. And that idea of like the ripe cervix, right? Yeah, I mean, I don't know why in obstetrics we got so into these fruit analogies, but it is true that you want the cervix to be like juicy and soft and thinned and ready, as opposed to blocking and holding it in. That transition takes some time. And that, like you said, is what part of what's going on with these practice contractions.
Yeah. And as a nurse, I always want people to know that you can come in and get checked whenever. Labor and delivery is open 24/7, 365 days a year, 366 on leap year. We're always there to make sure that you and baby are safe. And if you feel like you need to go in and see that the staff, and they can help you know that baby is safe and where you're at and like what to watch for as you move forward.
Absolutely. The same way I tell my patients, there are no dumb questions. All questions are welcome. There are no unnecessary trips to the labor and delivery. If you are worried, you should get checked. And if you think that you're in labor or that your bag of water is broken, you should get checked, because especially that first time, it can be so confusing. And there's this thing called prodromal labor, which is when kind of the practice contractions go on for a long time, but you're still not changing your cervix. And that can be super difficult and frustrating. But if you're concerned, always, always come in.
Yeah, or call your provider. A lot of providers
Yes.
have somebody that can talk to you on the phone. And I will say that when you've done it for a long time, a lot of times just talking to somebody on the phone, you know about what their cervix is doing.
Oh my God. Those triage nurses are like soothsayers. Like they know what is going on. That there's nothing like having a good experienced triage nurse.
Yeah. Okay, so what do you think is the most surprising things that first times moms don't expect about labor?
I think for first time moms in particular, how long it can take. That, in the movies or when people are recounting their labor stories, oftentimes you get the cliff notes, you get the highlight reel. But when you're actually in there for 36, 48 hours, especially if you're having an induction, I mean, that it really can be a long time. Sometimes it's kind of like dog years or whatever. It's the hours either feel really long or really short when you're in there slugging it out. What do you think?
Well, I think it's so confusing. It's because it was my second baby. I was a labor and delivery nurse, and I still had to I had to phone a friend because I still didn't know where, like, if should I go in? They were every like 3 minutes, but they weren't that painful. And my friend Yvonne was like, Hilary, stay home.
I
But
know.
when it's you and your body, you're like, I don't, and my husband freaking out. I'm like, if I have to deliver this baby, we'll be fine. But
It's true. It is true. When it happens in your own body, it is an entirely different experience.
yeah. So I say that if you are like, oh, I just feel so dumb because I don't know what to do. Hilary, labor nurse, even on my third baby, I'd been a labor nurse for 8 years, super confused.
Yep, 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 yep. And that's okay. We are, all just learning and growing together. So
Yeah.
take advantage of the people who are around you, your support people, phone a friend, as you said, and don't hesitate to come in if you're concerned.
Yes, for sure. Okay, so we've talked a little bit about like how I think it's surprising that people are at home for a while they're in labor. I think everybody kind of expects like they get that contraction, they know they go to the hospital. But where there's a lot of like sticky time at home where you're like, are these anything? So what do you think people can do at home while labor is building up to going into the hospital?
And I think this is really worth thinking about, because we're all different. We all have different things that help us cope. So there's lots of stuff. If you are a water person, and your bag of water isn't broken, getting in a bathtub can be a tremendous relief. So getting in the bathtub, getting in the shower, walking. Usually people feel better moving around. Then again, if it's a really long labor, trying to get a little bit of sleep, and trying to lie on your side and rest, if you've been doing this for a long time, is another strategy. I'm a mindfulness person. And so learning your breathing and meditation techniques is worth the investment, because you don't want to start pushing. You want to control any anxiety. Now, let's get real. You're going to be a little bit anxious, especially if it's your first time, but trying to really stay present in your body and feel your body is going to be super important. And then think about, again, it's many marathons. Like a marathon's only 3 hours. That would be easy. So thinking about, do you want a playlist to go with you? Make sure you have your snacks to come with you. Think about what are the different things that are going to help me cope.
Yes. You're going to learn a lot about Hilary as a person, but I always tell my prenatal class students, this is an awesome time to clean. Because as you get, like, if you're like cleaning the grout or whatever, you're on your hands and knees on a pillow, obviously, and your partner is there next to you because you shouldn't be cleaning alone, but that's a great position to move, to get the baby in the right position, and you're being super productive at the same time. So I'm always like cleaning, get some freezer meals packed up, or lay on the couch and watch some Netflix, but just make sure that you're moving constantly when you're not asleep, because sleep is awesome also. That's what I always tell people too.
Agreed. And, I'm a music person. And so my playlist was very important to me. And even in the OR, all my patients know that like Dr. Williams likes to DJ. And so I like to have I think your birth playlist, I have 2 boys. They both absolutely match the music that they were born to. And so like dancing, like moving around, even if it's on the side of the bed, moving your hips, that is a big, that's a winner for me.
Yes. Okay. Do you have tips on what the partner can be doing too? Because a lot of times they're just like, hey, here I am.
Well, I think that these are good. It's a really good to have this discussion ahead of time to figure out what the patient needs. So if you're the partner, making the playlist can be a very good one. Making snacks is really good. Having your phone tree already. So who you're going to call, what you need. I know we'll probably talk about doulas later, but also coordinating with the doula and following the doula's lead. Sometimes, you'll find a place on the person's back or hip that needs a little bit of pressure. Whatever it is, I really believe in giving pregnant people choices. It's hard to generate original thoughts when you're in labor, even in early labor. Like, your brain is being signaled to do something else. So instead of saying, honey, do you want something to eat? Say, do you want granola or do you want grapes? Or do you want me to run a bath or do you want to get on the sofa? Like, I think that ask question strategy and nothing get the heck away from me is also an acceptable answer. But to give people choices, I think is a good way to approach support.
Yeah. Definitely do not get your feelings hurt. That's one of the big ones for partners in labor. It's nothing personal. She's being attacked by a bear. You always have to look at it like she's feeling a little bit attacked by the pain right now. And also partners need to make sure that they're taking care of themselves. So I see partners a lot of time, well, if she can't eat, I'm not going to eat. And then that's when I'm picking them off the floor and feeding them orange juice. And then mom has a wonderful story to share for the rest of the time.
Exactly. Right? Don't be an idiot. Take care of yourself.
Yeah. That doesn't mean bringing KFC to the labor room while your wife's starving.
No, especially if the person is like NPO, they're not allowed to eat, and you're bringing like a huge meal in there.
Yeah. Eat some trail mix in the corner, buddy.
Exactly. Yeah. Exactly.
Okay, let's play the game 2 truths and a lie. So I will go first. Are you ready?
Yes.
Okay. So number 1, some women laugh through contractions, or if Hilary's your nurse, you might even be able to laugh at your baby. We've had to go very somber sometimes. Yes. Number 2 is you can actually push a baby out in 1 contraction. And number 3, eating a whole pineapple will jumpstart labor. Which do you think is the lie?
I think that I'm going to pick the pineapple, even though there are lots of pineapple myths out there around fertility and labor.
Yeah. Look at the studies, people. Look at the studies.
Exactly. I live in Northern California, and there is this pizza place here, and they have a Prego pizza. And everyone believes that, okay, if I just go and get my pizza from this place, but oftentimes things that are dietary, like castor oil or pizza with a ton of garlic and toppings, what it's doing is actually just irritating your intestines, and your irritated intestines will then be touching your uterus, irritate your uterus, and make you cramp. So that might start some contractions, not necessarily labor, but almost always diarrhea.
Yeah. Yeah. People always need to remember that pain is not the same as labor, because some people are like, do jumping jacks. And I'm like, oh, do not do jumping jacks. Ouch.
Exactly. Okay, let me think. Let my two truths and a lie. Okay. Number one, you can have a baby without even knowing you're in labor. Number two, singing during labor or dancing can make it less painful. And three, when your water breaks, it's always a gush that falls on the floor, just like the movies.
Oh my gosh. I wish it was like the movies, but I'm going to have to say number 3. And I think the most surprising part is most people's water doesn't break outside of the hospital, because everybody expects they're going to be grocery shopping and then boom,
Right.
have a giant swimming pool of water running down the aisle. And honestly, thank goodness we don't, because that would be hard.
It can really be confusing. And oftentimes you think, okay, is this just a little discharge? Is this my mucus plug? Or did I really break my water? Or most commonly, did I pee on myself? Because every person who's been at the end of pregnancy knows that head of the baby, if it's baby's head, that is right on top of your bladder. And it becomes very easy to have little leaks of urine. And sometimes it's a big leak. So it is a lot more confusing. And if you think that you've broken your bag of water, it really is important to call the hospital and to get evaluated.
Yes, for sure. Just one more thing in labor that is super confusing and not as easy as it sounds, because everyone's like, well, obviously your body turned on a tap, you're going to know your water broke. And I'm like, it's not like that, just like everything else.
Exactly.
Okay, what's the biggest labor myth you want to bust here today?
I kind of said it already, but that you do not know what your labor is going to be like. That if my mom had labor that was short, I will have labor that is short. And that so often I hear that perspective, and it's just not true. Everyone is going to have their own labor because it's not just you. It's not just your genetics. The baby is part of that sort of decision-making process, if you will. So it's always good to talk to your sister, your cousin, your mom, your friends, but it is actually not true.
Yeah.
What about you?
Well, I think definitely on that line, the expectation that your labor is going to be like your mom's, your sister, your friend's labor can really be a killer of you actually enjoying your labor, right?
For sure.
And then finally, I see so many people thinking they have so much control over labor. They're like, oh, I can put myself into labor. Like, oh, so many TikToks of people like, I wish I'm doing all these things to make myself have the baby. And I'm like, stop feeling guilt that you can't push yourself into labor, because that's not something you can physically do. You can't make yourself go into labor. So I wish people didn't. I almost felt guilt because I was 12 days overdue as a labor and delivery nurse, and my coworkers were like, "Are you insane?" And ultimately, I probably was. We don't need to feel guilt that we can't do something that we literally can't do.
The maternal opportunity for self-flagellation is endless, and I do not want it to begin in the labor setting. And so I always tell patients that, this is your first lesson in parenting, that these little people are not going to do exactly what you want them to do. It's not going to happen exactly as you plan. And I mean, my son's 18 and he still doesn't listen to me all the time.
Shocking. That is shocking to me.
Right. So we have to surrender a little bit to know that it's just going to be its own process.
Just like the rest of parenting, for sure.
Yeah.
Okay, what do you think about birth plans? Like coming in with some ideas of what you'd like to have go on in labor? Because I'm over here saying expectations need to be left low and that you shouldn't have any control, but then we say fill out a birth plan.
I think it's both and. So we should have objectives and also be flexible. So in general, even though I love the concept of a birth plan, I hate the word birth plan, because we can make plans, but babies can't read. And they also don't always, as I said, do what you say. So I prefer to say like my birth intentions or my birth preferences, because it is worth thinking through. And it's worth thinking through when you're not in the heat of the moment, so to speak. So thinking about, what do I want the environment to be like? Who do I want to be there? Do I want to have a circumcision? How do I want people to offer me pain medicine? Like, these types of things really are worth thinking about, and with your partner, with your family, with your doula, and then review with your OB. Like, if I have a C-section, I really want my partner to be able to announce the sex. Whatever it is, even if it's a small thing, especially if you have a particular cultural tradition that you want to make sure gets honored, it's really worthwhile putting it down on paper.
Yes, I totally agree. I like to call them birth hopes.
Yeah, that's good. Exactly. That's the concept. We put down our intentions, our hopes, our preferences, but we've got to stay flexible. I think some of the people that I've seen the most disappointed in their labor are the people who had very strict birth plans and wanted to adhere to them and weren't paying attention to what was going on with them in that moment, and with their baby. I mean, the March of Dimes actually has a fantastic birth plan on the website. That's a good place to start. There are a bunch of them out there, so it's worth taking a look at what are the types of things that are worth considering.
Yeah. Okay, so we've talked a lot about labor when you're due. So we're talking about 37 weeks and up when we've been talking so far. But preterm labor is a real thing, and that's something that we really need to watch for. Back in November, I saw that the March of Dimes released its annual report card, and it was not good news. 1 in 10 babies are born preterm in the United States, and we ended up earning a D+ for the 3rd consecutive year, which brings me right back to nursing school, a D+.
Nobody wants a D+. No one's gunning for a D+. That is not where we want to be.
Yeah. So how do you think we can make a change with this, Dr. Williams?
So it is a very real problem. And the United States has, the worst maternal mortality outcomes compared to other wealthy nations. And we have the worst preterm birth rate. That's 370,000 babies born too early. And so that's not acceptable. We have to be able to do better. And one of the things I'm super proud of at March of Dimes is the dedication to the research around preterm birth, whether it's diagnostic tools, therapeutic tools, things that we can do to try to stop it, support that we give families who have had a preterm birth. That range is really important. So first of all, you got to know when it's happening. And very often people don't, because they're not expecting it. So if for any reason you feel like your bag of water is broken, you're having watery, copious discharge, then you want to make sure that you get evaluated. If you're having any bleeding and you're pregnant, you want to make sure that gets seen. And if you're having pain, so oftentimes this pain it could be in your low abdomen, it could be in your back. There are lots of different ways that pain can show up. And again, not to feel bad if it turns out not to be preterm labor, because it's very important that we catch preterm labor as soon as possible so that we can give you medication to try to stop it. But even more important than that is to give you a shot to help mature the baby, mature baby's lungs, brain, intestines, in case that baby is born prematurely.
Yeah. And I think it's super important to know that, like, you're not, in general, most people are not doing anything to cause preterm labor because we don't really know what causes preterm labor to happen. So just like you can't control going into labor, you can't always control going into preterm labor as well. And so since we don't know what causes it, but we do know that there are some things that make you more likely to have it. So if you've previously had a preterm baby, if you're pregnant with more than one baby, or if you've had problems with your uterus or your cervix in the past, or you've had surgery on those areas, those can be real risk factors towards preterm birth.
Right. And, it's so important. I love that you said risk factors, because we have to separate out. This is not about blame. This is not about something you did wrong. It is just that you have an increased likelihood of having preterm birth. And so you need to be more prepared. You need to be a little more on the lookout for it if you have some of those factors. The other things to keep in mind are some of the demographic risk factors and some of the chronic conditions that lead to preterm birth. So diabetes, hypertension or high blood pressure, obesity, and then smoking, all of those conditions are associated with preterm labor. And so maybe if you are managing a chronic condition, to start getting ready a little bit earlier, and then to have your call list, educate your colleagues if you're going to work, let your partner know, so that these things can be in place. The burden also of preterm labor is not equally distributed through demographics. So Black birthing people are more likely to have a preterm birth than their white or Asian counterparts. And so that's another important demographic to keep in mind. And we know that it's a lot of different complex factors. You said that we don't know what causes preterm birth. That's not entirely true. We've got some pretty good research hints about what's causing preterm birth, around different proteins being expressed for a receptor on the uterus where the progesterone comes, and then the microbiome in the vagina shifting in a way that increases the stress and inflammation that then causes those proteins to be expressed. I'm doing a lot of sciencey talk, so I'm not going to get too far down this rabbit hole. But the thing to keep in mind is that inflammation and chronic stress can add to some of that expression. And so that's why exposure to systemic racism causes oxidative damage and inflammation in a person's body. And that's what we believe is some of that link for Black birthing people. And then also same thing with high blood pressure, diabetes, obesity. This is all part of oxidative stress and inflammation that can lead to preterm labor.
Yeah, and make sure that you're taking that baby aspirin if you have risk factors for preeclampsia. Got to get that in too.
For sure. So there are two types of preterm labor, and thank you for bringing that up. There is what we call iatrogenic or doctor-caused preterm labor, because sometimes the condition in the parent is getting so bad that it's safer for both the mom and baby for the baby to be born. And then sometimes it's spontaneous preterm labor and your body just goes in to preterm labor. So the baby aspirin can help decrease preeclampsia, which is a condition of the end of pregnancy marked by elevated blood pressure and impact on the organs. And that can be prevented, not entirely, but certainly decreasing the risk with just an over-the-counter baby aspirin. So that's become one of our big March of Dimes campaigns around letting people know if you are at risk for preeclampsia, it can just a simple over-the-counter baby aspirin taken daily can decrease your chance of preterm birth and preeclampsia.
Yeah, it's amazing how simple things like a baby aspirin, which was honestly a huge no-no when I started in 2001. People were not taking baby aspirin.
Nope.
But it's simple things, even like going to your prenatal checkups. You feel like they're kind of dumb and useless as a patient a lot of the time. But going to those checkups, they happen at times where, your risk of preterm labor is higher and your doctor can kind of ask you questions or put things in your mind for things to watch for. It's so important that you go to your prenatal appointments even if they seem sort of dumb and useless. Those are the best kinds. That's what I want. I want everyone to have a dumb and useless prenatal checkup.
I always tell people boring is good. If you are the most exciting thing I've seen today, that is not a compliment. That is not what you're aiming for.
No, it's definitely not what you want.
Mm-mm.
Okay, let's end this with something fun. So if you could only had 6 words or less to give some labor advice, what would it be?
Stay calm, keep breathing, you're enough. Because
that's
I
a good
think
one.
people so often don't feel like, I can't do this. Oh, why can my mom do this? Why can everybody else do this? But truly, you're enough. Our bodies are engineered to do this. This is how we've survived as a species. So please keep calm, keep breathing. You're enough.
Yeah.
What about
well,
you?
I used some hyphens. So be flexible. That's one of my big ones. Not in charge, always being hyphenated, obviously. And get prepared. I love that people are watching this video. I'm so glad that you are here if you are watching this video, because learning things, taking a birth class can be really important and help you feel so much more empowered when you're in birth and so much less confusing.
Absolutely. I love them. This is so good.
Yeah. Okay, Dr. Williams, thank you so much for joining me today. And we want to thank all of you guys for tuning in. Like I said, hopefully you're walking away enjoying this half hour. I want you guys to know that labor doesn't have to be serious and super sciencey. A lot of us are just having experiences, and it can be a little bit messy and crazy, right?
100%. But you will get through it. You will get to the other side. And then you get to the really hard part, which is actually raising your children.
Yep. And like we always say at March of Dimes, it starts with mom, because that's how it's starting out. Thank you for your expertise and your insights today. I hope people found it helpful and that you guys feel empowered and informed as you go through your labor journey. If you guys want more information about labor, visit marchofdimes.org for more information about labor signs, symptoms, and to download a copy of a birth plan for you to fill out, which can be super helpful, because I know a lot of you guys probably don't even know where to start with that. Thank you to March of Dimes and It Starts With Mom for creating this vital program and supporting moms and families everywhere. You can explore this more on itstartswithmom.org for previous episodes, more helpful information, inspiring stories, and up-to-date information about pregnancy and belong. And a big shout out to our partners, HCA Healthcare, Clearblue, GoldBug, Honest, Philips Avent, and Sanofi for supporting March of Dimes and families everywhere. Thank you for joining us. Thanks for joining us with Starts With Mom, and we love chatting about labor. We hope you guys share your wild, wonderful labor stories in the comments. And until then, good luck in your birth.